Trafficking, a holistic approach to U.S. drug policy reform. Drug trafficking into the United States remains a persistent challenge with significant social, economic, and security implications. The U.S. government has historically focused its efforts on intercepting drug supplies at borders, targeting international cartels, and pressuring foreign governments to curb production and trafficking. However, this supply-side approach has yielded limited success, as the drug trade continues to thrive, fueled by a robust domestic demand. The core argument of this essay is that the U.S. must shift its strategy in the war on drugs to prioritize demand reduction through rehabilitation, education, and addressing socio-economic drivers of drug use. Additionally, the U.S. must adopt a more introspective and less hypocritical stance, acknowledging its role in perpetuating the drug trade by failing to address domestic consumption while blaming foreign nations for supply. This essay provides an in-depth analysis of the current U.S. drug policy, evaluates its shortcomings, and offers actionable recommendations for a more balanced and effective approach. The dynamics of drug trafficking, supply and demand. Drug trafficking is fundamentally an economic activity driven by the principles of supply and demand. The U.S. is one of the largest markets for illicit drugs, including cocaine, heroin, methamphetamine, and fentanyl. According to the 2020 National Survey on Drug Use and Health, approximately 59.3 million Americans aged 12 or older used illicit drugs in the past year, with 21.4% of adults reporting drug use in the past month. This significant domestic demand creates a lucrative market for international drug traffickers, who exploit the profitability of supplying drugs to U.S. consumers. The U.S. government's primary strategy has been to disrupt the supply chain through border interdiction, law enforcement, and international cooperation. For instance, the Drug Enforcement Administration, or DEA, and U.S. Customs Service seize millions of pounds of illicit drugs annually, yet these efforts capture only a fraction of the total supply. The United Nations Office on Drugs and Crime, UNODC, estimates that less than 10% of global drug shipments are intercepted. The resilience of drug trafficking networks, coupled with their adaptability to law enforcement tactics, underscores the limitations of a supply-focused approach. As long as demand remains high, traffickers will find ways to meet it, whether through new smuggling routes, synthetic drugs, or corruption. The argument that drug trafficking would diminish if domestic demand were reduced is grounded in basic economic logic. If there were no buyers, traffickers would lose their primary market, rendering their operations unprofitable. This perspective shifts the focus from external actors, cartels, foreign governments, and smugglers, to the internal factors driving consumption within the U.S. By addressing demand, the U.S. can undermine the economic foundation of the drug trade, reducing the incentive for trafficking. Shortcomings of current U.S. drug policy. Overemphasis on supply-side interventions. The U.S. has allocated significant resources to supply-side measures, including militarized border security, international anti-drug operations, and sanctions on drug-producing countries. For example, the U.S. has spent billions on initiatives like Plan Colombia, which aimed to reduce cocaine production through crop eradication and military aid. While such programs have disrupted some trafficking networks, they have also led to unintended consequences such as environmental damage, human rights concerns, and the displacement of drug production to other regions, a phenomenon known as the balloon effect. Moreover, the focus on supply has often ignored the root causes of drug use within the U.S. criminalizing drug possession, and prioritizing incarceration over rehabilitation have perpetuated a cycle of addiction and recidivism. The U.S. prison population includes over 1.5 million individuals incarcerated for drug-related offenses, many of whom are nonviolent offenders. Harsh sentencing laws such as mandatory minimums have disproportionately affected marginalized communities, exacerbating social inequities without addressing the underlying issues of addiction. Hypocrisy in international relations. The U.S. has frequently criticized foreign governments, particularly in Latin America, for failing to control drug production and trafficking. Countries like Mexico, Colombia, and Bolivia have faced diplomatic pressure, sanctions, and even military interventions to align with U.S. anti-drug objectives. However, this approach overlooks the U.S.'s role as the primary consumer of these drugs. By framing drug trafficking as a foreign problem, the U.S. deflects responsibility from its own policies and societal factors that sustain demand. This hypocrisy undermines international cooperation and fosters resentment among partner nations. For instance, Mexican officials have repeatedly pointed out that U.S. demand, drives the violence and instability caused by cartels, yet the U.S. rarely acknowledges this connection in its foreign policy rhetoric. Similarly, the opioid crisis, fueled in part by domestic overprescription of painkillers, highlights the need for internal accountability rather than external blame. Neglect of demand reduction. While the U.S. has invested in some prevention and treatment programs, these efforts are underfunded and overshadowed by law enforcement priorities. The National Institute on Drug Abuse, NIDA, reports that only 10 to 20% of individuals with substance use disorders receive treatment due to barriers such as cost, stigma, and limited access to care. Public health campaigns and school-based education programs, while valuable, often lack the scope and intensity needed to address the scale of the problem. Furthermore, socioeconomic factors, poverty, unemployment, and lack of mental health services, contribute significantly to drug use but are rarely addressed in a coordinated manner. Recommendations for a holistic drug policy. To address the root causes of drug trafficking and reduce domestic demand, the U.S. government should adopt a comprehensive strategy that prioritizes rehabilitation, education, and socioeconomic reform. The following recommendations outline a path toward a more effective and equitable drug policy. 1. Expand access to rehabilitation and treatment programs. Rehabilitation is a critical component of demand reduction. The U.S. should invest in expanding access to evidence-based treatment programs, including medication-assisted treatment, MAT, for opioid addiction, cognitive behavioral therapy, and residential rehabilitation centers. Key actions include: increase funding for treatment programs, allocate a larger portion of the federal budget to substance abuse treatment, ensuring that programs are accessible to low-income and uninsured individuals. The Substance Abuse and Mental Health Services Administration, SAMHSA, should receive increased funding to support community-based treatment centers, reduce stigma and barriers, implement public awareness campaigns to destigmatize addiction and encourage individuals to seek help, streamline insurance coverage for addiction treatment and eliminate wait lists for rehabilitation facilities, integrate mental health services, address the co-occurrence of mental health disorders and substance abuse by integrating mental health care into addiction treatment programs. This holistic approach can improve outcomes for individuals with dual diagnoses. 2. Strengthen prevention through education. Education is a powerful tool for preventing drug use, particularly among young people. The U.S. should develop comprehensive, evidence-based prevention programs that address both the risks of drug use and the underlying factors that contribute to it. Recommendations include: revamp school-based education, replace outdated programs like DARE with modern science-based curricula that emphasize critical thinking, emotional resilience, and coping skills. These programs should be tailored to different age groups and cultural contexts. Community outreach. Partner with community organizations, religious institutions, and local leaders to deliver prevention messages in high-risk areas. Peer-led initiatives and mentorship programs can be particularly effective in engaging at-risk youth. Public health campaigns. Launch nationwide campaigns that highlight the dangers of drug use while promoting healthy alternatives. These campaigns should leverage social media and other platforms to reach diverse audiences. 3. Address socioeconomic drivers of drug use. Socioeconomic factors, such as poverty, unemployment, and lack of opportunity, are closely linked to drug use and addiction. The U.S. should implement policies that address these structural issues to reduce vulnerability to substance abuse. Key recommendations include: invest in economic opportunity, expand job training programs, affordable housing, and access to education in underserved communities. Economic stability can reduce the desperation and hopelessness that often lead to drug use. Improve access to healthcare, ensure universal access to healthcare, including mental health services, to address underlying conditions that contribute to addiction. Medicaid expansion and subsidies for low-income individuals can help close coverage gaps. Community development. Support community development initiatives that create safe, supportive environments for residents. This includes funding for recreational facilities, after-school programs, and community centers that provide alternatives to drug use. 4. Reform criminal justice policies. The criminalization of drug use has perpetuated a cycle of incarceration and relapse. The U.S. should shift toward a public health approach to drug policy, emphasizing rehabilitation over punishment. Recommendations include: decriminalize personal drug use. Follow the example of countries like Portugal, which decriminalized personal drug possession and redirected resources toward treatment and prevention. This approach has led to significant reductions in overdose deaths and HIV infections. End mandatory minimums, reform sentencing laws to eliminate mandatory minimums for nonviolent drug offenses. Judges should have discretion to consider individual circumstances and prioritize rehabilitation over incarceration. Expand diversion programs. Implement pre-arrest diversion programs that allow individuals to access treatment instead of entering the criminal justice system. These programs have shown promise in reducing recidivism and promoting recovery. 5. Adopt a consistent and accountable foreign policy. To address accusations of hypocrisy and foster international cooperation, the U.S. must align its domestic and foreign drug policies. Recommendations include: acknowledge domestic responsibility. Publicly recognize that U.S. demand drives the global drug trade and commit to addressing it through robust domestic policies. This acknowledgement can build trust with international partners. Strengthen bilateral partnerships. Work collaboratively with countries like Mexico and Colombia to address both supply and demand. This includes sharing intelligence, funding joint prevention programs, and supporting economic development in drug-producing regions. Avoid punitive measures. Shift away from sanctions and militarized interventions which often strain diplomatic relations. Instead, focus on capacity building and technical assistance to help partner nations address trafficking. Counter-arguments and rebuttals. Critics of a demand-focused approach may argue that it diverts resources from proven law enforcement strategies and risks appearing soft on drugs. However, decades of supply-side interventions have failed to significantly reduce drug availability or use, suggesting that these strategies are not as effective as claimed. Moreover, a public health approach does not preclude law enforcement but complements it by addressing the root causes of drug trafficking. Another concern is the cost of expanding treatment and prevention programs. While these initiatives require significant investment, they are likely to yield long-term savings by reducing healthcare costs, incarceration expenses, and productivity losses associated with addiction. Studies estimate that every dollar spent on substance abuse treatment saves $4.7 in societal costs. Finally, some may argue that decriminalization could normalize drug use and increase addiction rates. However, evidence from Portugal and other countries shows that decriminalization, when paired with robust treatment and prevention, reduces drug-related harms without increasing overall use. Conclusion: the U.S. cannot win the war on drugs by focusing solely on supply while ignoring demand. By prioritizing rehabilitation, education, and socioeconomic reform, the U.S. can reduce domestic drug consumption, thereby undermining the economic incentives for trafficking. Simultaneously, adopting a more accountable and less hypocritical foreign policy will enhance international cooperation and address the global nature of the drug trade. This holistic approach requires political will, sustained investment, and a shift in public perception, but it offers a path toward a more effective and equitable drug policy. By addressing its own shortcomings and taking responsibility for domestic demand, the U.S. can lead by example and make meaningful progress in combating drug trafficking and